initial vital signs of temperature 36.4 degrees Celsius, pulse rates of 74 beats per minute, respiratory rate of 18 cycles per minute, and blood pressure of 110 per 80 mercury. The nursing diagnosis is self-care deficit. This is hygiene related to neuromuscular impairment. So, objective. Within my 8 hours of care, patient will be able to demonstrate techniques to meet self-care needs. So, interventions that should be done. Check and monitor vital signs for baseline data. Check and regulate IVF as prescribed to prevent cardiac overload and fluid and electrolyte imbalances. And provide bedside care. This is to promote comfort and hygiene. And encourage SO to assess patient in moving around. This is to minimize the risk of accident for the patient. And then provide the patient health teaching regarding the importance of hygiene. This is to educate the patient and also to promote hygiene. And then assist patient in making health-related decisions and assist in developing self-care practices. This is to promote wellness and encourage patient to take meal rich in protein, example fish, pork, and etc. This is to promote healing and administer due meds as prescribed to facilitate treatment. So, evaluation after my 8 hours of care, patient was able to demonstrate techniques to meet self-care needs as evidenced by positive combing of hair, positive decision to cooperate with SO hygiene activities for the patient with latest vital signs of temperature 36.7 degrees Celsius, pulse rate of 70 beats per minute, and respiratory rate of 16 cycles per minute, and blood pressure of 100/70 millimeters mercury. So the discharge plan that should be given to our patient or to be educated sa atong patient. So medications, encourage SO to strictly comply with the patient's meds as prescribed by the physician, obviously to facilitate treatment. And then emphasize compliance to medication, explain to the SO and patient the nature and effect of drugs and the result if not regularly taken or taken in overdose to create awareness kay ang ano may effect niya. And then advise SO to keep PRN drugs always available. So for exercise, encourage SO to expose the patient to the sunlight in early morning. This is to activate the vitamin D in the skin, which will make our kumbaga improve the absorption of calcium in the GI tract. And then schedule rest periods between activities on the patient every day since our patient is bago pa lang na operahan. So another is encourage patient to do active exercises in moderation. And diet, for diet, encourage patient to take meals with foods rich in carbohydrates, protein, and antioxidants. Example, this is the grow and glow foods to promote healing and good nutrition. And next is instruct patient to take meals on time para di siya mapas mo sa. And then health teaching, encourage patient to observe proper hygiene and grooming to prevent infection and develop self-confidence. Since mabawasan yun talaga ang self-confidence kaya amputated siya. And then discourage patient on lifting heavy objects since one arm lang ang available niya, and then if he will use his arm in lifting heavy objects, so possible na magkaroon siya ng spinal na mga prone siya sa spinal dislocation. And then schedule for the next visit is encourage patient to consult a physician when pain or complication persists, and then encourage patient to participate on activities in their health center related to his present condition to gain knowledge and adapt to his present amputation.